Hi, everybody. This is Dr. Britt Talley Daniel, MD, and I'm a neurologist and a headache doctor. And I'm making podcast number 12 on the subject, which is called Postpartum Migraine. And I'd appreciate it if you'd click on my subscribe tribe so we can follow each other. So, the term postpartum refers to the period of time just after delivery of a baby. And postpartum itself is a Latin word, means I bring forth, give birth, or acquire. This refers to delivering a baby, and post means after, so postpartum refers to the period of time after the delivery of a baby. Now, after a baby is born, there's usually a great change in the life and responsibilities for everyone in the household, usually the mom and dad. First few weeks at home with a newborn are joyful, but also a challenge for all parents. 25% of women have migraine, and about 70% of them have a menstrual or estrogen relationship, usually with their menstrual cycle, where estrogen is high for 3 weeks and then low for the next week. Many women are not informed or warned about this migraine recurrence that could happen post-delivery period. So pregnancy is a high estrogen time, and migraine is rarer or improved during that time, only to come again after the baby is born and the menstrual cycle starts up again. These headaches would then be called postpartum migraine. Now, I have a blog on this at www.drmigraine.com, and I have pictures there of estrogen levels if you want to go read some more about this article. So what is postpartum migraine? Well, this is the occurrence of severe, sudden migraine headaches that come after the reestablishment of normal menstrual cycles after childbirth. Estrogen rises for 3 weeks, and then the headaches come as estrogen levels drop. Many times, these headaches are somewhat worse than the patient's previous migraine experience. But some women present with their first migraine at the postpartum time, usually with the first baby. And that's a real shock to them. The migraines come several days before, at the time of bleeding, or 2 days after bleeding. Postpartum migraine may be delayed by breastfeeding the baby. Related questions. How frequent is postpartum migraine? 1 out of 4 women will have a migraine within 2 weeks of delivery, and nearly half will have migraine attacks within the first month. This is a quote from Dr. Angeliki Vangtas, a neurologist at Brigham and Women's Faulkner Hospital. Quote, in addition to that, about 5% of women who have never experienced a migraine get their first one in the postpartum period. So we're talking about millions of women every year, and that is a very high number, period, end of quote. First-time occurrence of postpartum migraine is very common, but women in this situation are often poorly educated about what's happening and will need to establish a relationship with a neurologist and have testing with lab work and MRI scanning to sort things out and to provide an accurate diagnosis and beneficial treatment. So why do these migraines occur just after childbirth? Well, estrogen and progesterone levels during pregnancy are very high, and many women who had migraine before pregnancy will find their headache symptoms lessen or disappear during pregnancy. What are the migraine triggers after childbirth? A tip here is the best situation, previous migraine patients should discuss their occurrence of migraine headaches with their doctor and plan for them with an adequate supply of migraine medication that previously worked on hand. So, the triggers: sleep deprivation or frequent nocturnal awakenings. This is probably the number 1 trigger. The mother may be up for nighttime and early morning feeding and caring for her new baby. So she should try to take naps when the baby naps and ask family or friend to watch over the baby between feedings. Next, we got stress and overwork. Try to relax to deal with stress. Take a walk, get mild exercise, read a book, get out of the house, or chat with a friend to alleviate stress. Just having someone to help with caring for the baby so the mother can sleep may provide very great and significant maternal relief. There will be stress from all that has to be done. Mothers may need more help from husbands, other children in the house, mothers or mothers-in-law, sisters, or close friends. These helpers can be organized so the new mother is not alone with her baby to deal with everything that needs to be done. In the postpartum time, a mother may be more concerned about the baby than about their own health. but she may not be able to adequately care for her baby if she experiences disabling, severe migraine headaches. Migraine headaches are disabling, and persons with a migraine usually need to sleep or lie quietly in bed and cannot be up and about doing things. Dehydration occurs, so drink plenty of fluid and have a large water bottle nearby. Irregular meals can set off migraine, so eat well and avoid known personal food migraine triggers. If red wine gives you a headache, don't drink red wine during this time. Mothers should eat healthy foods regularly. And as preparation for delivery, mothers should stock their refrigerator and pantry with nutritious foods that are convenient to prepare and eat. Unknown family migraine link. There may be a history of migraine in the family which relates to the mother, grandmother, the aunt, or sister. And many patients with migraine, though, are not diagnosed, and there are migraine pseudonyms, or what's called false names, which may be discussed and mentioned in the family, but really doesn't give the patient a clue that it's really migraine. And these false names are sick headache, migraine turns on the vomit center, sinus headache. Well, there is no sinus headache. Most of those are frontal migraine headaches. Menstrual headaches, hungry headaches. If your blood sugar drops, you get a headache. One-sided headache. Migraine comes from a Latin phrase that means half of head. Nocturnal or middle of the night headaches. The mother with postpartum migraine might have been told if their own mother or sister had these false migraine names and not recognize her family link to migraine, which then puts her at risk for an attack of migraine. Migraine medication and whether or not to breastfeed. Migraine treatment and breastfeeding may affect the baby. Mothers and doctors worry about this. With her migraine treatments that don't affect the baby, sumatriptan, a successful migraine-specific drug, may be safely used. Caffeine, Tylenol, ibuprofen, and other what are called non-steroidal anti-inflammatory drugs, abbreviated as NSAIDs, may be safely used. Breastfeeding itself may reduce the experience of migraine. Breastfeeding mothers need to always determine if the medications they take are excreted in breast milk and whether they're safe for their baby. See my blog article on are triptans safe to take during breastfeeding. The mother may start an estrogen-based contraceptive during the postpartum period. The FDA said that all estrogen-based contraceptives, the pill, the patch, and the shot, are contraindicated with migraine. And contraindicated here means not to take. Starting a birth control pill can aggravate migraine occurrence. Now, the usual bottom line, though, is most postpartum headaches are tension headaches or migraine headaches, which may be treated at home with the help of their doctor. More severe secondary headaches should be seen by the doctor immediately and may require, again, neurologic consultation, blood work, and MRI scanning. So next I'm going to talk about the differential diagnosis and incidence of postpartum headaches. It may be that the headache the mother is experiencing is not a migraine. What else could it be? So here's a list of different types of postpartum headaches. It could be caffeine withdrawal headache. And the criteria for diagnosis of caffeine withdrawal are prolonged daily use of caffeine and then abrupt cessation or reduction total caffeine use, closely followed by a headache, and one of the following symptoms. The patient may have fatigue, drowsiness, anxiety, depression, nausea, vomiting, clinically significant distress, or impairment in social, occupational, or other important areas of functioning. Tension type headache could occur, and this is the most prevalent type of headache anyway. It's about 70% of all headaches. Tension type headaches occur on both sides of the head, are described as pressing or tight like a vice or like a band around the head, and they can only be mild or moderate in severity. On a scale of 1 to 10, tension type headaches can only go to 5. Patients with tension type headache may carry tension in their neck or shoulders and have muscle spasm knots in the back of their neck. Preeclampsia or eclampsia. Preeclampsia is a serious, life-threatening medical condition that can occur before or after childbirth. It's associated with high blood pressure and protein in the urine. It can lead to seizures, a coma, or left untreated, death. The headache with preeclampsia may be pulsatile, bilateral, and worse with activity. There may be visual changes or visual blackouts abdominal pain, decreased urinary output, or trouble breathing. Preeclampsia and eclampsia are medical emergencies requiring emergency medical assessment. Postdural puncture headache. It may not have just been an epidural, which is injected above the dura by anesthesiologists to give relief during the migraine process of birth. Sometimes the anesthesiologist accidentally pushes the needle too far and penetrates the dura surrounding the lumbar spinal nerves. Then a leak of spinal fluid may exist, which later causes typical orthostatic headaches. Means you get up and have a headache, lie down, it goes away, and a postdural headache may occur then. Cortical vein thrombosis. Pregnancy is a hypercoagulable state, and sometimes internal cerebral veins will clot. Symptoms of thrombosis may be headache, blurred vision, fainting, or loss of consciousness, paralysis of part of the body like a stroke, seizures, and coma. There's a syndrome called post-reversible encephalopathy syndrome, abbreviated as PRES, which presents with rapid onset of symptoms including headache, seizures, altered consciousness, or visual disturbance. This is diagnosed by certain patterns on MRI scan, and it may or may not be associated with hypertension. Space-occupying brain lesions like brain tumors. Brain tumors usually don't present with headache. They usually present with paralysis of some sort, visual change, seizure, memory, or speech problems. A subdural hematoma occupies space inside the brain, but it comes in the skull. After a fall or a blow resulting in head injury. So trauma causes subdural hematoma usually. Cerebral infarction or ischemia. This is stroke with symptoms like paralysis on one side of the body along with headache. Maxillary sinusitis. Symptoms here may be previous upper respiratory infection or allergic rhinitis symptoms followed by cheek, behind the eyes, or forehead headache along with green or yellow nasal discharge. Meningitis. This should be in every doctor is taught in medical school. Generalized headache, fever, and a stiff neck. The ER evaluation would be blood work, brain scanning, lumbar puncture. All these patients should be evaluated by neurologists with blood work and scanning. Breakdown or frequency of occurrence of different types of postpartum headache. So which ones occur? One study reported that in their sample group of 95 women with postpartum headache, 50% of them had tension-type headache or migraine. 24% had a headache related to preeclampsia, and 16% had a headache related to the anesthetic, like postdural punctular headaches. I'm also going to go in and review a postpartum migraine article because there's really not that much literature on this, and this is published in 2012 by Hashivama in Internal Medicine, entitled Postpartum Migraines, a Long-Term Prospective Study. And this article had, they investigated patients suffering from migraines over a long postpartum period in an OB ward in Japan. This was a prospective study of the course of migraine during the postpartum period by patients in a postnatal ward. The patients were surveyed during the first postpartum week and at 1, 3, 6, and 12 months after delivery. In general, what was found here was that breastfeeding patients had lower rates of headache, and the older you were, the more headache you had than if you were younger. So, enjoyed talking to you about this. God bless you, all your migraine patients. Hope you're doing well. Talk over these issues with your doctor. I'll see you again on the next broadcast.